just to be clear, you just told us that our son has cancer. And she said yes. And I think it's just one of those moments that you remember forever. Atlas was about 15 months old, and he was eating a cheeseburger from the grill on a Sunday night and just out of nowhere started crying hysterically, and we could not get him to stop.
We panicked, and eventually it passed and it was no big deal, but we still went to the hospital because we were nervous.
On the x-ray, they did find a cyst taking up the whole lower half lobe of his left lung.
The thought process was whether to just monitor it or to take it out immediately. So we wanted to get a second opinion. We scheduled an appointment over here, and in discussions with the doctors at Stead Family Children's Hospital, decided to schedule the surgery to have Atlas's, what we thought was just a benign cyst, removed from his lung at the time.
The surgery took a couple extra hours longer than we were originally expecting, and when she came out, she told us it was because the tissue looked a little bit different, and she spent extra time making sure that everything was really cleaned out in there and that she got everything.
And there's a reason she took her time, because it turns out that it was cancerous, and she could tell because of her experience and having done so many of the similar surgeries that it wasn't quite a benign CPAP like we expected.
I remember certain moments of that. Dr. Carlisle came into the room. Atlas was in a crib, but he was awake. Her face was so compassionate.
And she said that we sent the lobe that we took out, the lower left lobe and the mass, to out for biopsy, and it turns out that your son has pleuropulmonary blastoma, which is a very rare form of lung cancer.
It was very rare. The University of Iowa had not treated it yet, so it would be something that oncology would come to talk to us about. What's going to happen to your son, what's going to happen to your family, what this treatment looks like, what it's going to do to their body, what it might do to them, their personality, developmentally, because he was so young. Obviously, there were tears, we cried a lot.
But he took it really, really well. He was as high energy then as he still is today. We would see the effects of the chemotherapy drugs in him, and he'd have his challenging days.
For Atlas, the prognosis was good because we had found it so early. We were connected with the genetics team at the University of Iowa, and they did genetic testing on Atlas and confirmed that he did have the Dicer1 mutation. He'll eventually be more at risk for other cancers as he ages into adulthood. So while most kids do monitoring for 5 years after diagnosis, his monitoring is going to continue at the University of Iowa until he's an adult. So we work really closely again with the care team.
Atlas had 6 months of chemotherapy at 2 separate rounds with a little bit of a break in between. And after the first 12 weeks, they did a set of scans in the middle, and there was no signs of cancer at that time. Atlas is the happiest, most optimistic, energy-filled 8-year-old. He always sees the bright side in things, always happy.
We like to do tickle fights, and sometimes she's like, "No, I don't want to play with you." Then about 5 minutes later, she's like, "Brother, will you play with me?"
We always said, as Atlas got older, he never dropped an interest, he just adds them, but he keeps all the old ones too.
Always wanting to share things with those he loves, especially his sister Arden. He watches over her, takes care of her, includes her in everything, and is just the best big brother we could possibly hope for.